Orthopedics continues to generate the highest net revenue per case in a surgery center. Not only did it continue its reign as the most profitable specialty, but it also experienced a 4.5% increase from 2023 to 2024. So in 2023, the average net revenue per case was $6,141, and then in 2024, it was $6,419. For context, the second highest specialty is cardiovascular, and that only comes in at $4,611 per case, so nowhere close to ortho. Let's start with the demand. With an aging population, high success rates, and the push for outpatient over inpatient when it comes to joint replacements, ortho simply continues to be a high demand specialty for ASCs. Also, culturally, some of this stuff may seem frivolous at face value, but I think we're seeing some interesting behavioral shifts. The American Academy of Orthopedic Surgeons presented research confirming that pickleball-related injuries have increased dramatically, up to 90 times over the past 20 years. And at the same time, there's been an insane increase in usage of GLP-1s. And since these weight loss medications are becoming more accessible, people are losing more weight, which means there's an increase in activity, which leads to more injuries and surgeries. So again, these examples may seem silly, but, and there are, of course, many other factors as well, but I do think it's very interesting to consider how cultural changes like this will impact the industry. But more importantly, on the payer side, payers appear to be adjusting their rates to reflect the cost savings ASCs offer compared to traditional hospital settings. And leading ASCs are using data and outcomes to negotiate better payer contracts, and they're using data to better track implant costs to identify case profitability prior to accepting a case. This data comes from 590 surgery centers across 47 states and nearly 3 million patient visits. For more data and use cases, subscribe to HST's YouTube channel or visit our website to explore the full State of the Industry report.